I was born with my eye tooth embedded on the roof of my mouth, if you will. So I never lost my baby tooth. The baby tooth worked well until I was 40, at which point it died. And I had a crown on it and everything looked pretty normal. And so then I went to see if I could have my permanent tooth brought down, and I couldn't. It was fused to the roof of my mouth. So that's where the bone loss started. I was left with this huge dent in the roof of my mouth where they took the bone plus the permanent tooth out. And then I was given a bridge. And in the hole, there was a lot of bone loss where the baby tooth was. All of that just was this huge gap. What I wanted was to finally have a solution. My teeth were falling out one by one. They were walking their way across my face. First the baby tooth, then the permanent tooth next to it, then the front tooth. Now I'm missing 3 front teeth. And all I could think about was this bone loss is going to continue, and it's just going to tumble. Pretty soon I won't have any teeth left. That was my worry. And when Dr. Malmquist explained to me how this was going to be able to fill it in, how it was going to grow bone for me, I liked that idea so well, that it was going to grow bone, and it did, beyond my wildest. I never dreamt that for 25 years I've had that gouge on the roof of my mouth, and nothing was able to fill it in, but your product did.
An ideal candidate for this would be a patient who has a large defect, who is in general good health, who is going to benefit from having the architecture of the bone reestablished with one surgical procedure, and who can then benefit from the results of the graft either through dental implants or some type of cosmetic reconstruction.
Dr. Malmquist put in 2 implants, one on the front tooth and one on the eye tooth. And the idea would be to put a bridge in, because there wasn't enough room to put 3 implants across. And so he did this and wore the flipper some more. And then last September, doctor uncovered the implants. And then I waited about 2 months, and then my bridge was built and seated. And that was done the end of November. I have a perfect palate. That gouge is gone. The big, huge ridge from the bone loss is filled in. And it made me whole. I can't describe how wonderful it is. Those implants are in there. It is this solid, solid, solid feeling with no discomfort whatsoever. I mean, they were put on there, and it was like nothing was different. It was like my own teeth were back. When I clank them, it sounds the same as the other one. There's nothing moving around. Nothing is hurting. It's a delightful experience. I don't have to meddle around with a flipper anymore. I'm just thrilled that I'm walking around and nothing is loose. Nothing is loose. Nothing hurts. Nothing. I feel confident in my interaction with people, which to me means everything.